Mornings, आप सुन रहे फीवर 94.3 FM. This is Manasa keeping you company. Yes, it is about healthcare today, Hanji. And today to talk about robotic surgery, especially about knee replacement, I have Dr. Ratnakar Rao with me, a consultant orthopedician, Care Hospitals, High Tech City. Hello, sir. Welcome to the show, sir.
Hi, Manasa. Hi.
How are you doing, sir, today?
All good, Manasa.
And it's a huge challenge, no, sir, introducing technology in healthcare sector.
It's always challenging.
Yeah.
And it's always advantage also.
Yeah.
To how far we are using this technology to the human welfare.
Right.
That's more important.
Sir, I want to start with this firstly because we are talking about knee replacement surgery and robotic surgery in that. Tell us about it, sir. What is it basically?
People have a myth in the robotic surgery also. Robo is an arm in orthopedics. It's like an extra hand to the surgeon to help in the surgery.
Right.
So with this technology and human intelligence will help in recovery of the patient much better way. So technology is always good. If you use in technology in a right way, the results are very good to the patient. So robo is few years in India we are hearing it, but in the West it is a long ago it is came, and it is proving to be advantageous, and it is going to stay. Previously we talked about conventional knee replacement and the navigation is there.
Right.
Navigation hasn't stayed for long, but this is the advancement of the navigation where robo can help in the actual surgery itself.
Right.
So it's an extra arm and extra hand to the surgeon.
Right.
And it's like a brain work to the computer.
Fantastic. So much advancement, I tell you, in the field of healthcare with the help of technology. Precision and accuracy किसको नहीं चाहिए, especially एक surgery में. तो doctor, tell us about the advantages of robotic surgery, na, especially knee replacement में.
In robotic surgery, we'll feed the information to the computer.
Right.
After that, it will generate statistics values of the patient perspective.
Right.
So it depends upon, we have different style of patients, like long body architecture is different. Some are heavy, some are light, some are long, some are short patients.
Right.
So Indian knees are very small when compared to the Western style also.
Right.
So when we add technology to this type of knee surgeries, because the shapes are different from each and every patient.
Right.
So to get that precision level in conventional surgery also we'll have some difficulties.
Right.
So with the help of robo, which takes real-time statistics,
Right.
means we'll give the information to the computer, it will generate something on that. It will give precision levels,
Right.
how much to cut
Yeah.
exactly,
Yeah.
not too much or too less. It helps in less bleeding also.
Right.
That helps less infection and early recovery to the patient.
Right.
And our patients usually come at a late stage and the crippled stage.
Right.
Lot of people we see like they can't move at all and the legs are bowed.
Right.
In order to balance, surgery is entirely of thinking is not only cuts or removing the bone or putting the implants. It's a balancing thing.
Right.
You need to balance perfectly between all the muscles, front and back and side to side.
Right.
If these balances are rightly given to the patient, the end result is very good in movement wise, climbing up and walking, no pain.
Right.
So these are the advantages to the patient when the technology is added combinedly to the human brain.
Awareness is everything when it comes to your health. And so people get scared, I'm speaking out of experience. When you say robotic surgery, people are like, oh my God, no, there is a fear. Why do you think people fear? What can possibly go wrong? Right?
So people will think robotic surgery means robo will do the surgery.
Yeah.
For Indian robo like Rajnikant will do the surgery or something. It's not like that.
Yeah.
So in onco, robots are not new in the science.
Right.
So the first robotic surgery was done in 1985 in the US for onco. That's a
Right.
pelvic area. And advancement happened.
Right.
In orthopedics, usually quite few years the robots are there.
Right.
So advancement is like in onco surgery, the surgeon will sit in a console
Right.
and he will give the instructions to the arms. But in ortho robo, the surgery, actually the robo arm will be attached to the table or nearer to the table. Surgeon will perform the surgery. People
Right.
have a myth that robo will operate, doctor won't operate.
Right.
That's a common myth people will think. No, here doctor will operate. Entire thing was done by doctor and will take the assistance of extra hand of the robo in
Right.
performing cuts properly to the level of precision.
Yeah, that's the major difference between robotic and conventional knee replacement surgery.
Exactly.
And sir, is there anything else you would like to add about robotic surgery in knee replacement?
Because
sir?
commonly people will ask how much my knee will last,
Yeah.
how long.
Yes.
So what is the longevity? A simple example, if perfectly done,
Yeah.
for example, even if you fix a gold door in a wrong way, it won't long last.
Right.
So any implant, it's not about the implant, how you done the surgery, how you balance it, that is more important for the longevity of the knee.
That's right.
It is not the implant.
Right.
Your bone should be perfect, your soft tissue release should be perfect. You are giving ultimately a perfect balance to the patient.
Right.
That's what we say alignment.
Right.
Means our leg should become straight
Right.
to the body axis.
Right.
If you are straight, the walking pattern will change.
Right.
If it is not straight or some deviations will be there, the wear and tear on the plastic will be there. That's where the longevity comes from. If the perfectly done, the longevity will be lifetime.
Yes.
If it is not done perfectly, the wear and tear will be there unevenly. That won't give whatever implant you put, imported or Indian or gold implant, whatever it is.
Yes, sir.
If your alignment goes wrong or unevenly placed, the longevity won't be there.
Right.
So if it is perfectly placed, it will long last.
यार रिजल्ट्स अच्छे आएंगे 100%. तो प्लीज एजुकेट योरसेल्फ अबाउट दिस, इन्फॉर्म योरसेल्फ अबाउट दिस, एंड दैट्स एग्जैक्टली व्हाट वी आर डूइंग हियर. लास्ट में एक इम्पॉर्टेंट मैसेज तो बनता है ना डॉक्टर. इट्स बीन सच अ ग्रेट कॉन्वर्सेशन, बट जाते जाते डू यू हैव एनी लास्ट मैसेज फॉर अस प्लीज?
People will ask commonly what is the right time for operation.
राइट.
And people wants to delay commonly till last, till they cripple.
Yeah.
By taking some painkillers or some injections into the joint like steroid or PRP, they want to delay the surgery.
Right.
End of the day, they won't understand what's happening.
Yeah.
Because people will think it is a knee is not supporting,
Right.
but it is not the knee entirely. People are not walking and they will think my knee is not paining.
Right.
So they'll stop walking. By people are not walking means their lungs and heart also doesn't support them for
Right.
long,
Right.
and their capacity will also come down.
Right.
And it's a wrong choice to people wait till last, because the recovery won't happen.
Right.
When the people were walking and the lungs and heart are functioning properly, if the knees are giving a trouble, they can't able to do their activities.
Right.
Don't depend too much on the medicines, because
Right.
it's the right time to get the surgery.
Right.
If you are delaying it, you are delaying everything.
Very
Your recovery is delaying, your heart and lungs function are also delaying. When you want the surgery, they won't cooperate.
Right.
You'll have multiple complications also.
Right.
So people have to understand that by delaying, your health is delayed.
Right.
It is not about the knees, it's the general health is going. The circulation will be dampened. If you are diabetic, the sugar levels will increase. So always discuss with the surgeon. So what is the best time for the surgery?
So please don't delay such decisions and such surgeries, and also robotic surgery. This is what you need to look up if you're going for a knee replacement surgery, is what Dr. Ratnakar Rao, who's a consultant orthopedician at Care Hospitals, High Tech City, is telling you all. But thank you so much, sir. This was absolutely helpful information.
Thank you. Thank you, Manasa.